Dr. Pat with Little Critters Veterinary Hospital, and we have Gerald here, a 1-year-old male neutered rabbit, and he's in his little bunny burrito right now. Gerald lives at an assisted memory home, and the staff noticed that he had been shaking his head. So we're just going to scoot him around here so you can see his ears. Common problem in rabbits. And if you look into the ear canal, this ear canal all the way down is full of scabs and redness or erythema, and it is present in both ears. And these are ear mites. Very, very common problem in rabbits, often not readily observed by owners, because if you just look at him, you can't see that as readily. Things to watch for are scratching the ears, fur loss around the ears, sometimes from scratching, or shaking of the head. And it's a little harder to see in this ear, but it can be subtle. If you look at this ear just at a glance, it looks okay. When we turn him, and you look down in the ear canal, you can see the scabs go all the way down into the ear canal. This is a pretty good example of a more subtle presentation in the right ear, and then a very dramatic presentation in the left ear. We do give them a pain injection and clean these ears out because these are scabs. The mites actually bite and chew on the lining of the ear. These bunnies are very, very uncomfortable. And we will clean these out. We coat them after we clean it with mineral oil. It's soothing to the ear and it helps drown any mites that are left. And then we use selamectin topically because these mites can be all over them, not just in the ears. And so we do applications just between the shoulders of a selamectin medicine and 3 applications of that. And typically they are fully cured and back to 100% with normal, healthy ears and much more comfort once these are taken care of. And you can see Gerald is a very sweet boy and he deserves the best of care. If you look on the outside of this pinna, you can see on the outside that this area, even through the ear, is bright red, and that corresponds to the area of the scabbing. We call this erythema, and it's increased vascularity and redness, almost like a rash from the inflammation due to the mites and the irritation they're causing. Another important point is, again, the mites can occur on the body, and sometimes you'll see scaling or crusting or white, heavy, what looks like dander elsewhere on the body, and that can certainly be mites. Ear mites are one, but they also get walking dander or Kailitiella, which is a fur mite that we can see in them. We're going to get Gerald taken care of and get him more comfortable. We are sedated and did get a pain injection, and then the ears were cleaned out. Did do cytology, and we have many mites on the microscope. And this is the ear pinna after cleaning. You can see it's a very ulcerated surface. There are lesions kind of throughout the inner pinna, so pain control after this is very important with these bunnies. And watching the ears, doing regular maintenance, make sure they're not shaking their head or scratching, and then early exams will prevent a lot of this. This is the normal surface of the ear here, and then if we look down in the ear canal, you can see the ulcerations where the mites were. But we are starting topical treatment with the selamectin, which will kill all the rest of the mites. We've cleaned out the ears, and we expect this little one to be 100%. We'll just control pain and inflammation.